Good morning, everyone, and welcome to PHAMCAST. I'm Margaret Wallis-Duffy, the founder of Preventative Health Awareness Month and Movement. And I got to tell you, it is an epic day today. Today is Bone Health Day here at Preventative Health Month, year 3. And I got to tell you, yes, Dr. Doug, before I even introduce him, he's dancing, Megan's dancing, because we are pumped. You know, as the visionary behind this Health Canada approved movement, Preventative Health Month movement, it has been humbling to watch the growth and the momentum over the last 2 years. This grassroots movement has taken hold and now crossed borders and has over 65 healthcare professionals from all disciplines contributing to the education to stock the preventative health toolbox of North Americans. Now, you all know me as a proud registered massage therapist with a background in kinesiology and the owner of an award-winning preventative and integrative health clinic for 30 years. My passion in musculoskeletal health is well known, and my passion now for this new innovative technology called the REMS bone scan, which we're going to dive into, is getting even more exciting. So on today's episode here on a remote sort of PHAMCAST, we're going to dive in to bone health in a different way, and in an integrative way. So before we do that, I want to introduce the people on the screen here. Dr. Doug, who was dancing. I didn't know you were a dancer, by the way, but I'm loving it. I'm putting my glasses on so I can read his impressive bio. Dr. Doug Lucas is a board-certified orthopedic surgeon and osteoporosis specialist. He retired from orthopedics to further his mission to educate the world that osteoporosis is not only preventable, but often reversible. Now that's empowerment. His personal health story led him to the world of functional medicine and biohacking, which he brings to the bone health space. To help achieve his professional mission, Dr. Doug wrote 2 Amazon best-selling books, The Osteoporosis Breakthrough and The Top 10 Reasons Why Hormones Are Failing You. I can relate to that. He has also started the hit YouTube channel, The Dr. Doug Show, Bones, Hormones, and Health Span. He serves as the founder and lead physician for his nationwide clinical telehealth practice, Optimal Human Health, MD, and PHAM Bioidentical, as well as the team leader for his international osteoporosis community, the Osteo Collective. Dr. Doug now travels the globe, spreading the message that bone and muscle health are the key to longevity and health span. And let me tell you, how proud am I and how excited am I to have him as one of our FEMbassadors. Welcome to the show, Dr. Doug.
Nice to see you.
Thank you, Margaret. Nice to see you too, Megan.
Pretty exciting. We've been trying to get this going for quite some time. But nothing happens before it's supposed to. So this must be the perfect time. Yes.
It is indeed. So for all of you also watching, Megan Burmester, my partner, she's the founder of Osteosound, who has been instrumental in bringing and leading the charge here in Canada with the Osteosound REMS bone scan that her and I are partnering, the Osteosound difference. We are not just making sure that we are providing REMS bone scans with the ultimate care, as Megan has 25 years of clinical experience as a sonographer, but we also recognize the importance of education, bringing a new bone scan to a country that's going up against a well-established OHIP covered test called the DEXA. We knew that education was going to be pivotal for everyday people and physicians alike. So Megan, you and I have been having a blast for the last 3 years, doing what we're doing. And of course, having people like Dr. Doug join us is so important. So, and Megan, just so everybody knows, she is on a ship somewhere in the Pacific. So if her quality isn't quite as good, we'll forgive you, I think. Okay, so Dr. Doug, let's dive right in right away. So one of the things that the three of us have in common, other than our passion for bone health, musculoskeletal health, and prevention, is that we're part of a global community that's new and really determined to bring this to the market in a respectful, responsible way. Can you speak to what SEMA is and why we're part of it?
Yeah, absolutely. So when I was first introduced to the technology you're talking about, REMS, I was really excited that there was a new technology that could help us to differentiate some of the discrepancies that we see in DEXA. As you mentioned, DEXA is the gold standard. It is what everybody has. It's the World Health Organization definition of osteoporosis, but it only tracks density. It doesn't tell us about quality, and it only kind of tells us about fracture risk. So there's a lot to be desired in an imaging study around bone health. Now, the REMS is cool because it gives us some additional information, right? This is ultrasound technology. There's no radiation. It can tell us what's happening inside the bone, and we can tell both density and fragility or fracture risk. And that's really important to me because people are coming to me asking me the question of, can I do X, Y, Z, right? Like, can I play golf? How much weight can I lift? These are impossible questions to answer with just a DEXA. Now, they're still difficult to answer with a REMS too, but at least we have more information. And then I was introduced to SEMA, which is the group that you're talking about, the Society for Echographic Multispectrometry Association. That's what it stands for, I think. Yep. So SEMA, we'll call it SEMA. So SEMA is a group of, we'll call them bone health advocates who are looking to work together to bring this information forward on a global scale, because we have, I don't know how many countries we have represented, but it's a lot. So bring this forward on a global scale in a way that provides not only the information from the scan, but also what to do with it. Where do people go next? How do we get in front of the right people? Because it's great to have a new technology, but it is fighting against this gold standard, which is accepted in every country. So it's hard to bring this to people without a very directed and intentional way. And then it needs to be done in a way that is constructive and is helping people to identify what the right next path is for them. So that's the role of SEMA, and that's why I'm interested in being a part of it.
Well, thank you. Beautifully said, and exactly the reason why from the first day that SEMA began, Megan and I were part of that. As leaders here in Canada, bringing this new technology here, we feel a real sense of responsibility to ensure that we're bringing it to the market in a way not only that the average Canadian will understand, but also that physicians will be able to understand. And we're playing our part in that. And we want to be, as leaders here in Canada, we want to make sure that we're connected to organizations like SEMA so that we have our voice heard, but more importantly, so that we're working, as I always say, better together, which is important. So let's dive in a little bit about our passion in bone health.
What's really amazing about this group, this SEMA group, is that Marg and I have started using, whether this is wrong or right, that DEXA is the current standard. It is the current standard globally. So we know that there are drawbacks with the technology, but it's what we've used and referred to for so many years. So we just feel like REMS should now have a spot at the table because it's the more preventative space that we're working from, right? We know that we can do REMS as early as age 21, whereas DEXA, historically, we're not looking at people until they're in that space where they really have fewer options as to what they can do to kind of rebuild bone or strengthen what they have. So, we're not, I want to preface this conversation by, we're not trying to, speak poorly of DEXA. We know that both of these tests, DEXA and REMS, are just a snapshot in time, and they require further investigation. It's an opportunity to say, okay, this is a piece of my health puzzle, and there are so many other pieces that I have to put into play to make sure that I'm doing the best thing I can do for myself for optimal health. So I just wanted to preface before we get too far into the into the rest of the conversation.
Yeah. Well, and Megan, just a quick follow up on that. I'm happy to speak poorly of DEXA because I think it's misleading a lot of people. So I'm happy that we can usher DEXA on its way out, and I don't know what that time frame is, but that's happening. It's outdated technology. We need a better system. So I'm happy to take that role and kick DEXA to the curb.
Well, when we know, well, I also think that, but also I do believe in science. Science is an ever evolving thing. When we know better, we should do better. And just because something has been a standard for a very long time, if you believe in science, we need to adjust, pivot, and change when we have the evidence to do so. And as you just said, Dr. Doug, that is exactly the case here. So I'm bold as well because I've worked in the preventative and integrative health space for 33 years, long before it was cool to do so. And I may not have a physician title behind me, but I do have degrees, and I have a foot in both sides of the equation, both with allopathic healthcare professionals and complementary. Notice I didn't say alternative because I don't believe it should be one or the other. So thank you for stating that so boldly because I believe that too. But we also want to be inclusive of all things. So let's talk about bone health. And that's why I'm wearing my shirt. We've got your back. Because after you've had your REMS study, the question always is, now what do I do? What do I do to improve my bone health, or what do I do to prevent it from getting worse? And of course, the conversation starting earlier, 21 and older, is a game changer, which is why we've dedicated a whole day during Preventative Health Month to that. From your experience, Dr. Duggan, you're stepping away, which I'm hoping to do soon clinically from treating, although I love it. I will find it hard to not clinically have my hands on people because I'm good at it and I love it. But to do bigger things, and that's what you're doing in the educational space. Tell us, what you're bringing to the table from education. I certainly know when it comes to the now what question.
Yeah, absolutely. Well, so let me just clarify that statement, because right now my patients are going, "What? What do you mean he's walking away?" No, so I'll maintain a small patient population for myself, but ultimately what I see is that when we started treating patients with osteoporosis with the goal of reversing this naturally, the literature supported the concept, but once we started to see it clinically, and I was just looking at our Slack channel, and I just had 3 patients who literally, massive jumps in BMD in 12 months, and these are 60, 70-year-old patients, right? So like it just over and over and over again, we see that it's possible. We can change the trajectory of bone loss. We can improve bone metabolism. We can reverse osteoporosis. But ultimately, it's even more than that. Ultimately, what we're doing is helping people to realize a better health span, how to live better longer. Now, I love doing this in my patient population, but what I found is that I can teach my team how to do this, then we can do it on a much bigger scale, because I can only see so many patients. In fact, right now, I can see very few patients. I have like 2 patient slots a week on my calendar. So I can't see very many patients, but I can build a team that can see more patients, because so many of the things that we see are things that are relatively simple, right? They're not necessarily easy to do, but the lifestyle things, right? Like all of those things, which we can get into. What's the right supplement based off of your biomarkers? What are your genetics predisposing you to? What is your gut health doing? What are you eating? What does your hormone optimization look like? That's why I wrote the book about hormones, because I see so many women who are on quote unquote hormone replacement, it's not doing anything for them. And so we can optimize these things. And when you do that, you typically see that curve just sort of like bottom out and start to come back up. And so I want to bring this not only to my providers so that we can do this on a bigger scale in our practice, but ultimately to our community, the Osteo Collective, and then out through SEMA from an educational perspective, because this is a 200 million person problem. And that's probably undershooting it, right? Because we don't even screen young adults. So we don't even know what the problem is that we're dealing with. And for the vast majority of people, especially as you said, if we identify this younger, then we can stop it before it starts. We can identify a downward trajectory when they still have normal bone density, and we can figure out what's wrong. I look at bone health as a biomarker of health span, meaning that if you're losing bone, something's wrong. So let's figure that out. Let's fix that, and then the bone will correct on its own.
Well, and I love what you're bringing up there. And we always talk to people that we have the privilege of scanning, and then I see to pour in the educational consult about the now what and stocking their toolbox. And that is getting curious and asking the question, why? Not just here's your T-score and here's your medication for your osteoporosis, but rather getting more curious and becoming the CEO of our health to ask, well, why is this happening? What could be happening? And that's why we need a team of integrative healthcare professionals working better together so that, yes, we can look at gut, we can look at hormones, we can look at sleep, we can look at cortisol dysregulation. We can look at, all kinds of different markers that could be contributing to find maybe that one piece of the equation that someone hasn't looked at that's going to change the trajectory. And you're right. Your musculoskeletal health is the foundation of all health.
Right.
We don't have a good musculoskeletal system. We can't move. It impacts our cardiovascular system, our immune system. This is what fires me up about the education we're bringing around this technology because of what it's allowing, what types of conversations it's sparking from it. Yeah. So when you're talking about,
I think
Megan,
sometimes when we're talking about this too, because we're, Marg and I are advocates, we're not physicians. We're always very clear with the people that we see as well, that we're not here to give you treatment plans or tell you what to do and things like that. We're here to support, because there's a huge gap in the system and people are looking to be heard. They're looking to be listened to, but we feel that it's really important, to be a conduit to the people who can help them. And that's, I think, more where we're positioned, whereas you're in a role as a physician where you could actually go through those things with them. We know what's available and we want to help them research. We want to help them, as Margot always says, get in the driver's seat so that they can, investigate these things and research for themselves. It's their own health journey. So they have to make their decisions that suit them the best. Sorry, go ahead, Mark.
For sure. I'm going to add to that though, Megan, because I am a regulated health professional here and in the musculoskeletal health space. So I can speak in my lane, which I do.
Yep.
And have consultations with me one-on-one, and they have it covered through insurance because I'm, under the Regulations Health Board, the Regulations Health Act, rather. But you're right. But my 33 years of experience of collaborating with people like Dr. Doug and others, once I'm out of my scope and I want to, that's why Dr. Prowse for hormones, for example, that's what the Osteosound difference is. So Dr. Doug, let's talk a little bit about some of those key, what you said, simple, not always easy, because we have this pill for an ill, wait till it's broken, sick care mentality. Right. So when you say to someone, well, you're going to have to change their lifestyle. Well, really, doc, do I have to? Can you just give me a quick fix? It is powerful when we change lifestyle, nutrition, exercise. Can you speak to that and sort of how you're helping educate people and motivate them so that they're seeing the difference? I mean, seeing the outcomes is how people get motivated, for sure.
Yeah, well, this is an interesting way of asking that question. So you just said something really interesting, which is many people do want the quick fix. And this is, there's a lot of reasons why our system, the conventional system, is what it is. But one of the challenges that doctors face, even if they are motivated to talk about lifestyle change, is that many patients actually aren't interested. In fact, arguably, most patients aren't interested. Now, we all live in a unique space because patients we see are interested. And so it's very fortunate that the things that we practice and preach and investigate and learn more about, we love talking about these things. Our patients actually do want to hear what we have to say about them. But many patients don't. And this is why I have a very pessimistic view about the direction of our healthcare system, because it's a downward spiral that is only feeding itself at this point. And I don't know how that resolves itself. But the good news is that if you're looking for information and you're willing to make a change, we are, as a network of integrated providers, we are actually coming together to provide this type of support. And so there is a silver lining. There is hope out there that you can find people that can help you do this. And our technology and information age is certainly here to help us do that. So the things that we find that are super powerful, I would say if you were to divide them up into three groups, it would be diet, exercise, and hormones. I mean, those are the three big ones. From a diet perspective, we see almost all of our patients come in with a similar starting point. So most of them are underweight. We have a few overweight patients, but most of them are underweight. They're under-muscled, and obviously they have osteoporosis. And they didn't get there overnight. So many of them have been eating a nutrient-poor diet, too few calories from chronic dieting, or potentially they have gut dysfunction and just simply can't eat that much. All of them are under eating protein. And so when you take that group as a starting point and you say, okay, well, let's optimize protein. Let's optimize, your nutrient intake to the best of our ability, do it from whole foods, and get as much nutrient dense food as possible that works for your gut and improve gut health. It's amazing what changes, right? Everything gets better.
Yes.
Including your bone turnover markers. So hands down, that's the biggest thing. And that's why we have more functional dietitians than any other team member on our team, because it takes a lot of time and it's hard. So it takes a lot of time, a lot of accountability, a lot of follow-up, and it never goes well out of the gate, right? Because it's hard. Yeah. And that's why I say it's simple, but it's not easy to change the way that you've been eating for decades. Now, the opposite thing is true too for those that struggle with overweight and obesity and also have osteoporosis, because that's a unique challenge. And there are ways to handle that too. It's just kind of a different approach. But that's, hands down, number one. The exercise component is interesting too, because as somebody who came from kind of a fitness background, I've just always been exposed to athletes, and sort of from my perspective, everybody lifts weights and this is everybody wakes up and does this thing. But it turns out that's not how most people live. And so the people that are coming into our program, especially the women, have never lifted a weight in their life.
Yes.
And so then we say, okay, so we got to start doing some resistance. What's your starting point? How do we get you progressively overloading? And it's going to be a very, very simple starting point. But again, making that life change is challenging, and it's scary. Now that they have osteoporosis, they're scared, right?
And
What if I fracture?
Exactly. And I wanted to jump in there to say exactly that. It's the one thing to want to do something, but we know what we all face when in these bone scan clinics and doing the REMS studies is the overlying fear that comes with them. The fear of, well, I can't golf anymore. I can't do yoga. I can't pick up my grandchild. What do you mean I have to lift weights? And it's so important that we're having these candid conversations, because I agree with you. You know, I was a competitive athlete. I've always been active my life, and lifting weights is something I've always done. But most people have not. And then they layer over the fear of this diagnosis and what their physicians are telling them, Dr. Doug.
Totally.
Don't you dare do this. You're going to, don't go skiing. How do you address that?
Yeah. I mean, it's tough, right? Because I can never tell someone that they're not going to fracture.
Of course.
But this is what I want to get forward to everybody listening and to my patients. When they ask me about this, they say, well, can I play golf? And we're like, okay, well, let's where are you right now? Right? Like, have you had a fracture? What is your starting point? Like, what is your bone density? What's your fragility? If you haven't had a fracture and you've been golfing until today and your doctor said don't golf, the likelihood of you fracturing if you golf today is pretty darn low. It's not zero, but it's pretty darn low. So let's consider this hopefully the bottom point of your trajectory of your bone health. Let's build it, and then you can keep golfing. It's harder with things like, can I go horseback riding and skiing? I'm like, well, it's riding the horse isn't the problem, right? Like, it's the falling off the horse that's going to be an issue. Same with skiing, same with mountain biking, same with road. I mean, all these things, right? So we can't say somebody's not going to have a fracture, even with resistance training, right? Like, what's about the first time somebody does a deadlift? Could they have a spine fracture? They could. But we know that the trajectory of not doing those things is also to have a fracture.
Oh, and you're so right. That risk-benefit ratio in collaboration and consultation with your healthcare team, not just fear-mongering and one solution, here's your medication and don't do anything else. We know how that ends. And this is why Preventative Health Month, this is why I created this movement and campaign that is now taking over, because we need to have these conversations, both for the everyday public, but also for our colleagues in conventional and complementary medicine alike.
Yeah, absolutely. And I'm not saying that the doctors are wrong, because they want to prevent fracture just like I want to prevent fracture. But the difference is we have different tools, right? So like, I can follow them. I have a training program. I can teach them to progressively overload. I have a trainer on staff, right? Like, I have these resources. I still can't guarantee that they're not going to fracture, but I can teach them the tools to help improve their bones, so that if they were to go the other route, and I hear this all the time. I actually had somebody say, she said, I'd love to do your program, but I just don't want to have a fracture. So I'm going to take the drug and then I know I'll be okay. And I was like, whoa. If you look at the studies on the drugs, they still fracture. They just fracture slightly less, right? So like, you're not avoiding fracture by going the pharmaceutical route, arguably potentially making yourself worse in the long run. But we have to do the things that we know are going to improve bone health. And that includes potentially some things that are quote unquote at risk.
Sorry, I wanted to add in, because as we start talking about REMS, like up to this point, we've really just been looking at quantity of bone. And I'm sure you've seen, Dr. Doug, as you're seeing these REMS reports coming through, people can have normal bone density, but have poor quality of bone. And people can have poor bone quantity, but have good, strong bones.
Absolutely.
So how are you specifically, when you see somebody like that, how are you connecting the dots for them and saying, look, and we also know that all fractures aren't created equal. So I don't know if there's a risk or a classification of fractures, because we get a lot of people asking us that as well. Well, I mean, if I fall off a bike, is it the same as, if I was walking and I fell over? So I'd like us to dive into that. I know we might not have enough time, but I think that's something that it usually comes up in conversation, is how do we work with quantity and quality and then classifying fractures?
Yeah. Right. Yeah. So I'll address the quantity and quality first, and we'll get to fractures. So this is tough, right? Because everybody comes in with a DEXA. Everybody's had a DEXA, and then they get a REMS, and the REMS, it may be similar, but it may not. Right. So we have seen some huge disparities between REMS and DEXA, and then repeat on both. And you're like, wow, on DEXA, your T-score is -5, and on REMS, it's -1. Which one's right? And the truth is, we don't know. We can't know the answer because they're just different technologies. We're measuring different things. Now, I will say that this person who's had a T-score of -5 on DEXA that has a -1 on REMS and a good fragility score, I'm pretty hopeful that this person is probably pretty resilient, has reasonable bone quality, and we can be more aggressive. But I've also seen some confusing cases of people that looked good on
Right.
REMS that had a history of multiple fragility fractures. So I don't think we can across the board say,
Exactly.
trust the REMS, it's better. No,
Mm-hmm.
they're different technologies, they're telling us different things. So it's always a case by case scenario. What is your history? What do we think your fracture risk really is? We use our best guess to help create a plan. We start conservatively, slowly, progressively overload.
And I think too, if you could speak to, and this is well documented, you don't have to go far to find it, the discrepancies and discordances in DEXA are real. Positioning, calibration. So can you speak to that as well? Because you're talking about two different types of technology, DEXA versus REMS, right? One's ultrasound, one's X-ray. Discordances are less on REMS, and I think that's a point to make. So can you speak to that?
Yeah, and that was actually just published by Nick Birch, I think last year, right? So he looked at all of his data. He has thousands of data points on REMS and DEXA together. And you can see on the same people that what's called discordance, meaning having a difference of osteoporosis versus osteopenia or osteopenia and normal bone. Having a discordance on DEXA is more common between sites. So like hip and spine, for example, or one hip to the other hip. So that's more common than on REMS. And so it makes sense then that REMS is likely more consistent because osteoporosis is, unless you're not weight bearing, osteoporosis is a diffuse, it's a body-wide problem. So the discordance doesn't make sense. And so if somebody's had a DEXA and their spine was -4 and their hip was -1, that doesn't really jive with the way that bone metabolism works. So I would want to look deeper into that. And you're absolutely right. The different machines, different companies, different scanners. I mean, there are so many variables. If you were to drink a gallon of water before you do a DEXA and take a calcium supplement, you could totally change your DEXA score. You could change your T-score in a second. So we can game DEXA. I actually did this last year. I was doing a body comp thing, and I was like, I totally gamed the DEXA, and it said I had 7% body fat. It's totally not true. And so you can just understand what the technology is, and you can change the outcome of the score. Now, people aren't generally trying to do that, but that's the problem with DEXA, is that it's just not great technology. It was needed at the time. This was in the mid 90s, but we're ready to move past that. The technology is here to do it. We need to move past it.
Well, and one of the things I love, there are many things I love about REMS, but, and I've seen Megan at work doing this. If the discordance happens on the REMS during a study, she's going to repeat it. There's no radiation. It's time. We're not charging them 3 times if she has to repeat it 3 times. But it's also the reality. If you're at a DEXA suite, there's time, money, radiation to be considered. And so often we're basing treatment plans on a result of a DEXA. Whereas REMS, we're going to repeat it 2 or 3 times because there are, in some cases, discordances there, with reason behind it. So I think that's important to also talk about is that. So we've talked about nutrition being critically important. We talked about exercise. So I know we're going to need to wrap up soon. So let's also talk about that last piece. And really important to me, hormonal health. I went through menopause at 39. I had severe endometriosis as a young athlete, went misdiagnosed for years. It has impacted my musculoskeletal health without question. And if it wasn't for the help of Dr. Christy Prouse, OBGYN, functional medicine doctor, and a specialist in hormones, I know that my REMS would look very differently. So can you speak to hormones? And there's a big buzz now. There's a menopause movement. I'm here for it. Yeah. But it's more than just that. And it starts what about the young girl or boy that has an eating disorder and they never reach peak bone mass? Or what about thyroid hormone? Can we talk about the overall role that hormones play in our musculoskeletal health?
Yeah. So let's just start as a young adult, and then we'll work our way into peri and postmenopause. And so, gosh, as a young adult, there are research studies looking at women who don't cycle regularly. And this is unfortunately extremely common, right? So dysfunctional cycles, ovulatory defects, women that aren't ovulating, they're having irregular cycles, or they're on birth control and they're not cycling at all, right? So all these things happen. So we know based on the literature that if a woman isn't having that normal push-pull of rise in estrogen, fall in estrogen, rise in progesterone, fall in progesterone every month, if that isn't happening on a regular basis, she's losing bone. So even for women that have normal estrogen levels, but dysfunctional progesterone levels for whatever reason, we know that they're losing bone. So we know that the natural rhythm, the push-pull of estrogen and progesterone is critical to bone health. true in women from a cyclic perspective. In men, it's also true, but it's a little more steady state, right? So men's testosterone levels, they're going to aromatize into estrogen, and that estrogen helps support our bone and cardiovascular and brain health. But the problem is that we see dysfunction in both, premenopausal women, normal cycling women. We see this dysfunction all over the place, starting at a very young age. And we also see low testosterone levels in men, starting at a very young age. So this is why I said earlier, it's a 200 million person problem. Actually, it's probably much bigger than that. We just don't know because we don't screen young adults yet. So it starts early. And then as we go through adult life, usually bone mass is stable for a couple of decades, but with hormone dysfunction, probably not. So as women get into perimenopause, when especially estrogen levels start dipping, progesterone may actually not be getting driven up, ovulation defects again, issues with the cycle, we're going to start losing bone. This is why we should at least be screening women right at menopause or 10 years before, preferably, and throughout that perimenopause timeframe, because we know that they're going to start losing bone. This gets even worse if they have low testosterone due to adrenal dysfunction and other stresses, which is super common. So women are just set up for bone and muscle failure because of all the societal stresses, right? This is the perimenopause and early postmenopause timeframe is a really challenging time from a societal perspective for women, because you're a sandwich generation, right? You've got aging adults, you've got young kids often, and many women also then have a career and a demanding spouse, and all this stuff together is nearly impossible. So you have adrenal dysfunction, you've got gut dysfunction, it's hard to eat well, just pile it on, right? So we need to support women as they go through that. And then once they go through menopause, then this is a no-brainer conversation. You have to get screened. You have to know what your bone health is, and then have a conversation about hormone replacement. It's not for everybody, and that's okay. But right now, it's being massively underutilized. The Menopause Society this last year in 2024 put out a statement that said that 4% of eligible women are on HRT. And this is just in the US, but 4%. That is a ridiculously low number. It is such a big component. If I were to just draw, if I could do one thing, right? And this is actually why I have a hormone company outside of my other practice. If I could do one thing, I can optimize your hormones so that we can then get your bone health headed in the right direction.
And in doing that, because we know the body is interconnected, and when we want to talk and switch the mindset from lifespan to health span, when we do that and we balance hormones, there's a cascade of many aspects of health that improve, right?
Absolutely.
Which is what is so important about this conversation. And here in Canada, as I mentioned, Dr. Christy Prowse and companies like Science and Humans, which you should know about, Dr. Doug, which is an online platform of the nurse practitioners. This is giving access to the average Canadian to get access to having their hormones checked, finding out whether they are a candidate, and then shipping those hormones to their door. Barriers to access being reduced. And under the tutelage and training of Dr. Christy Prowse with nurse practitioners. And here in Canada, that means more access. And here's why. Because, in order to get hormonal testing here, it's not as easy, and it costs money. And whereas a nurse practitioner, primary care physician, a lot of this testing in labs can be covered when it's done by a nurse practitioner. So this is why collaborating with companies like Science and Humans and GraceMed, Hormonal Health Institute, and Dr. Prowse, and people like you, our friends across the border, our FAMbassadors in the US, is really, really important. And that's why I was so excited to have you on today during Bone Health Day. And lastly, I know we're going to have to wrap up, and I hope you'll come back, maybe when Megan and I are actually in a real studio. But one of the focus days during Preventative Health Month, we have different focus days throughout the entire month, different themed weeks. So the first week of February is mindset and health esteem. Nice. All that we talked about today, shifting the mindset.
Right.
You've got to take agency, and it takes work. A whole week on nutrition and food as medicine, a whole week on sleep and stress, and a whole week on movement and mobility, and then various focus days. Oh, who's this sweetheart?
She's a little visitor.
Hi, little visitor.
Oh, I know. One of those focus days, hi, sweetheart. One of those focus days is Eating Disorder Day. And I was just with Dr. Christy Prowse and Kyla Fox of the Kyla Fox Center for recovery from eating disorders and shifting the mindset. Megan and I are so excited because we're going to be doing one of the first Osteosound REMS bone scan clinics with the Eating Disorder Recovery Center, Kyla Fox, because that's prevention at its best. Bone health is silent until we break, and that's not good enough. And this is why these conversations matter.
Yeah, well
For
said.
the future of beautiful little ones like that one.
That's right.
Yeah.
Just a second.
Well, Dr. Doug, thank you so much for your time and energy today. Thank you for being one of the growing ambassadors to our friends across the border in the U.S. You know, I am beyond humbled and proud to lead this movement that I know is going to go global. The time is long overdue. Yeah. It is time to look at prevention today for a healthier tomorrow. And these types of conversations are critically important to change that for everyday people and healthcare systems and change makers like insurance companies to help us move this mission forward. That's critically important. Thank you for your time. I know how busy you are.
Yeah, awesome. Well, thank you. And I really appreciate the work that you're doing. Thanks, Megan. I appreciate your time.
Have a great day and happy FAM, everybody. Make sure you're checking out Preventative Health Awareness Month and Movement. Follow us on famhub.ca. If you've got questions for Dr. Doug or any of our guests, please reach out. We are here to help you become the CEO of your health. And remember, until next time, a healthy tomorrow begins with prevention today. We'll see you all soon.